Come in.
Hi, my name is Paula and I am a nursing student. I'm going to do your head to toe assessment today. Would you mind telling me your name and your date of birth?
Dennis Hunault, October 22nd, 1983.
Okay, great. I've washed my hands before I came into the room and a tech has already came in to do your vital signs, so I'm going to go ahead and get started on your assessment. First, I'm going to start at your head and I'm going to inspect and palpate for any depressions, abnormalities, or lesions, and there is none. Next, I am going to palpate your sinuses. Just let me know if you feel any tenderness. I'm going to palpate your frontal sinus, okay, your maxillary sinus. Okay, great. Next, I'm going to test your cranial nerve, number 5, your trigeminal nerve. I'm going to touch your face with a cotton ball. Just let me know when you feel it.
Feel it. Feel it. Feel it. Yep.
Okay, great. Next, I'm going to check your cranial nerve, number 7, your facial nerve. If you could bite down and smile real big for me. Okay, and puff out your cheeks. All right, your smile rises and falls equally. Okay, next, I am going to check your eyes. They are bilaterally equal, and your pupils are round. Okay, equal. I'm going to check their reaction to light. If you could look at my nose for me. Okay. All right, both pupils equally react to light. Next, I'm going to check your accommodation. If you could look at my pen and at the wall. My pen at the wall. My pen. Okay. Both pupils equally accommodate. Okay, I'm going to check your conjunctiva, and it is pink and moist, and your sclera is white and moist. Okay. And we've already checked your cranial nerve number 2, your optic nerve on the Snellen chart, and your vision was 20/20. Okay, great. We're going to move right along to your nose. If you could tilt your head back for me. Okay, there's no sign of a deviated septum. There's no flaring of your nostrils during normal breath. I'm going to check your patency. I'm going to close one of your nostrils and just sniff. Other side. Great, there's no sign of a blockage. Tilt it back one more time for me. Your mucous membranes are pink and moist. Okay, great. Next, we're going to go to your mouth. Your lips are smooth and moist. No sign of cracking. If you could open your mouth for me. Wider. Your buccal mucosa is glistening pink and moist. Your tongue is red and moist. Your teeth are white and shiny. Your gums are pink and moist and fit tightly to your teeth. Open your mouth one more time for me. Your uvula and your tonsils are intact. If you can move your tongue side to side, it moves freely. Okay? And then we're going to go to your ears. Your ears are bilaterally level. Just let me know if you feel any tenderness. I'm going to palpate your auricle for temperature and your tragus. Okay, great. Next, we're going to check your cranial nerve, number 8, your acoustic nerve with a whisper test. If you'd close your ear for me, I'm going to whisper in this sign. Just repeat after I say 5, 6, 7.
5, 6, 7.
The other side, please. 9, 10, 11.
9, 10, 11.
Okay, great. Thank you. Next, I'm going to move on to your neck. If you would tilt your head back for me. Your trachea lies midline to your body. There is no sign of masses on your thyroid. Okay, next I am going to auscultate your carotid artery. You just breathe normally for me. Okay. There was no sign of a bruit, which would indicate stenosis, which is a narrowing of the artery. Your sounds were normal. Okay. We are going to move on to your cranial nerve, number 11, your spinal accessory nerve. What I'm going to do is push down on your shoulders, and you're just going to push against it, and then we're going to do your face, and you're going to push against it. Okay? Okay? Alright, great. Both sides are equal in strength. Next, I'm going to move on to your thoracic, your anterior thoracic. Okay, I'm going to palpate for temperature, skin color, masses or lesions. There's none. Your heart is located in your second and fifth intercostal space. I'm going to go ahead and auscultate your lung sounds. Just breathe normally. Okay, your lungs sound normal, no adventitious sounds. If you could just take a deep breath for me. Okay, your both lungs expand equally. There's little sign of using accessory muscles, and there's no visible pulse seen from your anterior thoracic. Next, I'm going to listen to your valve sounds. Let's start at your aortic valve, which is located right of in your second intercostal space. Your pulmonic valve, which is left of your sternum in your second intercostal space, and then your Erb's point in your third intercostal space, your tricuspid in your fourth intercostal space, and your mitral valve in your fifth intercostal space. Also in your fifth intercostal space, you will hear your apical pulse, and it is located at the mid-clavicular line. Okay? Great. Next, I am going to move to your posterior thoracic, and I am going to palpate for any masses, lesions, or color and temperature, and there's none. Color is consistent with the rest of your body. I'm going to auscultate your lung sounds in the 9th spot. Okay. Next, if you could take a deep breath for me, in and out. Both lungs expand equally. Okay. I'm going to move on to your upper extremities. Okay. And I am going to inspect and palpate. The skin is smooth and dry. No sign of lesions or edema. Okay. Test your turgor. There's no tinting. Come down and check your capillaries, and they refill within 3 seconds. There's no sign of clubbing. Okay, we're going to check your brachial pulse, your radial pulse. Both are bilaterally equal. All right, we're going to move on to your deep tendon reflexes. If you'll just relax your arm for me, and we're going to check your tricep, and your bicep, and your brachioradialis. Okay, and on the other side, just let your arm hang. We're going to check your tricep, your bicep, and your brachioradialis. Okay, great. Both sides were equal in strength and bilaterally equal. Next, we're going to check your range of motion. If you can raise your arms for me, this is abduction, and then down, adduction, and check your flexion and extension. Okay, great. Both sides are equal. Next, we're going to check your neurological sensation with a dull and sharp test. If you close your eyes for me and just let me know when you feel it dull or sharp.
Dull. Sharp. Sharp. Dull.
Okay, great. Both sides are equally.